Hello viewers, we are now back with a new episode of Beyond the Headlines. I have with me here a book called as The Checklist Manifesto, How to Get Things Right. In this age of COVID-19, it is very important to get things right. The checklists have to be very accurate and the management has to be precise. To talk about COVID management in Meghalaya, we are now joined in by the Chief of the COVID-19 Task Force, Shri P. Sampath Kumar.
Thank you.
Welcome, sir, to this program.
Yeah.
It's an honor to have you. We
Thank
know
you.
that you're a very busy officer. You've been doing a lot of work ever since this COVID-19 has created this pandemic across the globe. So I would like to start with, you've been here since 1997 onwards, after you joined the IES. And throughout these years, you've been meeting people. Have you ever thought that in Shillong, a time would come where people would have to refrain from shaking their hands and you have to do namaste?
Yeah.
So can you tell us about this?
So I'll start with a philosophy. Maybe I think that's better to start with. So in fact, when you talk about we never basically realize that we will have a time where we actually refrain to shake hand, or maybe we might like to use our elbow or namaste. Okay, so I think this is I think the COVID has is teaching us a concept of finite time. This is what I wanted to say. What does it mean is that there is whatever the things that you wanted to do, as you mentioned, you should do it right, because it has alerted everyone, in fact everyone, and across the globe. So it's not only Shillong that has been affected, the entire world has been affected. It started just maybe the last year, December, in China. Today it is everywhere. So what I'd like to, for the benefit of the viewers, I would like to tell two things about the COVID. I think we all have to really understand these two distinct characteristics of COVID. It is highly transmissible. That means its transmissibility is very high. So as I said, in 6 months, it's transmitted from China to US, Italy, India. You look at this entire thing, and including Meghalaya and Sikkim were the only two states, and we were not having any COVID for quite a long period. Quite a long period means in terms of every day is important. I consider every day is like equivalent to 100 years. So it has affected. So one is transmissibility. The second important thing is that it is invisible. So something is invisible. So you don't know. One is that you don't know who is carrying virus, because majority of them do not show any symptoms. It's invisible. So you are absolutely perfect, but you might have got contact with a virus and you are carrying that virus along with you and you are not aware. And the other is that, suppose this is a surface, we don't know, it's a public place, let's say. We touch the surface, and after touching the surface, I am eating a biscuit, or I touched somebody else. without washing my hands or using sanitizer. So that's again invisible. So these two characteristics everybody should understand and deal with it. So what we have been trying to do in the state is that to make people understand the disease and protect themselves by creating a protective shield around them through a behavior change.
Right.
For example, both of us are talking, you are wearing mask, I am wearing mask, the chances of contracting this is only 5%. If I don't wear the mask and I start talking to you, then it's about 70%. So, and we don't know whether I am carrying the virus or not. So that's why by default everyone has to assume that unknowingly we might be asymptomatic, we might be carrying the virus. So we have to change our entire behavior in such a way that we are actually isolating the virus, like through mask or through sanitizer and through a physical distance. I think that's the message that we would like to convey to everyone. So for that purpose, in fact, we have constituted behavior change management committees. In fact, the districts are doing, our deputy commissioners and the DM and HOs, they are forming these committees to go to every household, train everyone with a counseling, why it is so important, because this is the only way we can actually handle the COVID very effectively. Yes, if you get contacted, then also nothing to be worried, honestly, because majority of the cases are recovering, especially the asymptomatic people, without any medication. So it's like any other flu. But in case of those the elderly people with comorbid conditions, they need to be protected well. So again, they need to protect themselves. First thing is that self-help is the best help. So all the people, they need to actually create this protective shield through a behavior change, and then they can actually they can use some checklists. Again, as you mentioned, it's one of the famous books written by one Harvard professor. So checklists, like we are actually giving an individualized checklist to measure their behavior, and there is a score. Everyone actually daily they can see the score. Okay, how much whether I went to the public place, whether I have breached, where I went to public place unknowingly, I taken the mask and I was talking to a shopkeeper and I came back. So then it's a breach. Then you will get 0 marks. But if you have done, you will get full marks, one point for every question, 1 point. So 10 in a scale of 10, you should measure that you are getting at least 7 on a daily basis. If you do this, I think if you change our behavior, so then actually what we are doing, everyone is contributing for containing this pandemic. So that's so important. So it's not that it can be contained only by sealing the borders. That can be done for some time, but we can't do it for a longer period. One. Number two, even if it is done, if this care is not taken, actually it can actually from one person to another person it can transmit. That's what happened in some cases, even in Shillong. Yeah. Thank you.
So this behavioral change, yes, it's very important because we are living in a new normal. But at the same time, they say old habits die hard. So that is going to be a challenge for you and for the entire, health department. So how are you going to, really be aggressive?
Yeah, I think it's a very good point you said. Actually, behavior change is not that easy. But one thing that COVID is teaching us is that time is finite for everyone. In fact, I just wanted to go to another point actually, which is important for all the citizens, is that what is the life expectancy in Meghalaya? it's only 62.3 or 5. National average is 68.5 something. So it's around 5-year gap. So why? So it's essentially because, we have, maybe a lot of maternal deaths are happening because our maternal mortality is high. That's what now we have started working. COVID is actually teaching us, okay, entire healthcare, infrastructure, healthcare actually, in fact, the behaviors need to be changed. So we started understanding why mothers are dying. Almost like close to 200 mothers die annually in the state. Close to. And sometimes 160, 180, like that. This is the reported data I'm talking about. So we started, when you said like then, when we started actually discussing this, with different stakeholders, so when we started discussing this, and actually it's like everyone started understanding, oh, this needs to be stopped. Now today we are seeing like, even in the remotest places, our Ashas and ANMs, they are going to do the ANC checkups, antenatal checkups, because there is a motivation now. There is an issue that we need to handle it. Why so many mothers are dying? We need to reduce these maternal deaths. So I think we need to make this realization. I think COVID is teaching everyone this, that concept of finite time. So what's going to happen? In fact, we have done one, survey through Indian Institute of Public Health, Shillong. We have a very good research institution in this region. In fact, now we are fortunate that like it is there in the state. And they have done this, in fact, here they presented, in fact, day before yesterday, the results about how the people are actually, changing the behavior in terms of these practices like hand hygiene, physical distancing, and, wearing a mask. So we found pretty good results. At least, there is the change generally doesn't happen, but very short time the change is happening. But that is not sufficient. It has to, go. That's why our effort is to make sure that like this behavior change happens to everyone, and it is the only way. Currently, people are not aware. People are still thinking that like, maybe this can be solved by, setting up a check post. That is required. But that's not alone sufficient. Okay. So that's what we are saying in the behavior change. We are saying like one very important concept, like even it's important even for anyone. So many times we think that, the change can happen through external support. But actually the real change happens when each one takes that responsibility. So that's called, the change, we call it like in a locus of control, You depend on external, help for making this change to happen. But actually the real change happens, if there is an internal locus of control. So where you take that responsibility, you create a protective shield. So if everyone start doing that one, this COVID can be isolated. So that's the approach that we are trying to do. Yes, definitely what you said is age-old habits. It's not, it's very difficult. But one good thing for our Meghalaya is that we are having beautiful communities. We live in communities. We have a great system, traditional systems. So if they understand this, they do very well. In fact, so far, if you ask me, the way the Meghalaya, still I see the numbers that what we have been seeing. In fact, the Meghalaya residents, if you look at technically, BSF is actually a separate territory. Because so you don't count BSF because that's a different systems. In fact, they have different protocols, and they go to their own territory. Of course, only thing we should be worried is that like their interface with the civilians. That also we are having systems to take care of that one. But what is important is like we are still less than 100. Active cases wise around 70 as on date. So what this essentially why it is happening because of our communities. Our communities actually are taken very seriously. In fact, even we'll get to know like, some new person comes, they immediately inform, okay, there is a new person, he has to be tested. It's happening. In fact, that's where some cases have been found. So we have a beautiful community system, and we have a good state, a system, I would say, very proactive, state government. Why I would say, in fact, we meet, even like while coming to this, we have today Sunday, we have a video conference, a Zoom conference with all our deputy commissioners. So the state is working like 24/7, like a machine. So we have beautiful community, and we have beautiful state, and everyone, actually, in fact, everyone, I have not, in fact, everyone, in fact, we have I would say, I call it like a triple helix model. You have I call it like a, see, you have a, three people, like, you have this community, and and basically the government system, like a catalyst, like, who are working, both, I would say, the government plus community. And we have a leadership, the I would say leadership, and then we have a nice, I would say, even the media. So because it's also important, communication, like how actually we are trying to everyone working together to see that, like, this is, actually this situation is handled very effectively. I think there is a sincerity of purpose among everyone. I'm sure, I think, we'll be able to handle it. The thing is that, as I said, like, each one has to take responsibility. In fact, as I said, like, each one has to understand this disease first. More importantly, they should understand it is highly transmissible. One person left alone can actually infect 400 people in a month. So, and those 400 people can infect another 400 each. So, in no time, actually, the transmissibility, that's what happening all over the globe. So that's why it's going one place to another. So another is invisibility. So you can't see it. So only way you have to, you have to learn a kind of a martial art, how to actually isolate this virus. So like the way we are putting a mask, and using the sanitizer, or hand wash practice, hand hygiene practices, physical distance. If we do these things, and as quickly if you do, we actually can set as an example. In fact, the way the predictions are going on, maybe we might see about 14 million cases in next 3 months. That means almost like 1.2% of the population. So even if you take that numbers, it's like very, you can't, it's alarming numbers. Right. But no need to be worried. Even if it happens, we don't require to stay calm. Many of the cases, actually, as I said, like, what you require, this disease can actually be handled through isolation. So it's like a, if you create an isolation system within, every individual creates an isolation system, or a kind of a protective shield, virus will automatically die. So I think that is the key thing. So one has to understand this and bring that quickly. So I think I have spoken a lot about behavior change, but I thought this is so important because we have in fact the government has declared the next 2 days as lockdown for behavior change. I thought it's useful for our residents of Meghalaya to understand this. Thank you.
Thank you, sir, for explaining to us the need and the immediate need to bring about this behavioral change. So coming to the numbers, as on June 24th, we had only 4 active cases. Now we are touching nearly 250 active cases, including the BSF. Of course, they have their own campus, and hopefully they have not been able to come into contact much with the general public. But coming to the civilian cases, nearly 70 plus of them, contact tracing is very important aspect of this disease. So how precise are we
Yeah.
when it comes to contact tracing, sir?
We have, again, we have we have a very precise surveillance system. We are calling a precise surveillance system. So we have a contact tracing teams. In fact, if you look at a Shillong, there is a zonal wise Shillong has been divided into zones. Zone wise, we have a contact tracing teams headed by the magistrates and the Rangbash norms, and everyone is involved. So definitely that's one method. The second thing, we also have another method is that we are using technology. We have a data, like whoever is entering, especially we have the data. But those cases, like some cases which are happening, like not because of the returnees, but because of some other incidences, somebody, so those cases actually we are using this contact tracing teams, and in fact the community also is very cooperative. They quickly give the information. As I said, like we have a beautiful community. In fact, that's the strength of Meghalaya. So I think we are really, I think if something is happening or differently in this state, is essentially because of that.
So because of this high rate of transmission and as you said, the invisible nature of this virus, the general public are panicked. Sometimes they give these panicky reactions. And one thing that we see on social media and other forms of media, they say, why can't the government release the locations, not the names, but at least the locations for where these cases have been detected? Because as of today, we know only the districts, but not the precise locations.
Yeah. See, in fact, we have been sending this location details, to the respective localities. The headman knows. Suppose if there is a case is detected in Mopram, the Mopram actually there is a system, the Deputy Commissioner's office would actually inform. That system is there. So what you are saying is that, like, announcing those names in the public, that also can be done. It's more, basically, but like there is a system that's happening. Yeah.
So that why they want this? Because they want to ensure that, okay, did I go to that locality? Did I meet somebody from that locality? I mean, that's the general mindset of the people.
Sure.
So coming to the work that health workers and other frontliners are doing, they must be under a lot of stress, especially those at the border, those who have to go and take samples. So overall, as chief of the task force, what is the morale of the frontline workers?
They're very good. In fact, today, I think we should really appreciate and commend the efforts of the entire healthcare force, right from the DHS and Managing Director NHM to all to the right from DMNHOs, medical officers, and those lot of lab technicians whom we have hired on a contractual basis, and a lot of nursing staff and those cleaning staff. They're amazing. In fact, the commitment is amazing, because we have a good leadership at various levels. As I said, like continuously, there are. In fact, we have a civil hospital. There is a in charge of civil hospital. They are really, they have taken it as a very important issue, and this is the time I think they have an important role to play, and they are discharging that role very diligently and with a lot of commitment. Yeah, and there is, and the satisfaction is that when things are going well, that itself motivates people. So that's where we are talking about this behavior change again, just to tell that yes, so far this has been done this way. Now actually we need to understand this one, and everyone has to become like a healthcare worker. Everyone has to become like a healthcare worker. This is what the message, the next we are calling, create health social capital. What does it mean? Everyone understands the basic things. So we have created ashas. These ashas are actually the frontline healthcare workers who are actually, been trained. They're actually, they're not, they have not done any medicine or anything, but they have been trained, In fact, when we train them how to actually, to test a malarial case, they learn. And today, 70% of our cases, malarial cases, are handled by ASHAs. So what I wanted to say is that we have to really take this knowledge and build the capability of community in terms of managing the COVID also. The way now today ASHAs actually are able to identify the malaria case in the village. They test using a rapid diagnostic kit, and if it is positive falciparum, they have the medicine to give. And today deaths are very low. When I was DC Tura, like way back in 2005 to 2007, the deaths due to malaria used to be around close to 100. It's a huge number of deaths. Today actually they have come down because the ASHAs know. Now we have put in a system where ASHAs can test and treat patients there itself. Similarly, we have to, like, each person should know how to handle COVID. So the moment actually if you know how to handle COVID, I think we are done. So that's what the public health response to the COVID. So public health means, this is the word, public health means you actually train the public, the community, to handle the health issues easily. So by basic practices. So this is what we are saying. The clinical, next comes to the clinical management. Yes. Clinical management is where, it's not with you. Asymptomatic patient, suppose if somebody is positive, doesn't have any symptoms, he can be treated at home. What he requires is simple, is that one isolated room, one independent room. That's it. And a caregiver, somebody who can actually take care of the food and, make sure that, measure, whether he has got any symptoms and all. Then, if there are any symptoms like respiratory distress, he needs an oxygen support, then he needs to be shifted to the hospital. But otherwise, that's kind of a system that we need to build in. So we need to build that state capability to handle the COVID by actually capacitating each and every individual of the state. So that should be our focus, and that is our focus. And as you said, the health department, in fact, is trying to accomplish that one.
So coming to health infrastructure, what difference do you see during the pre-COVID days and now?
There's a huge difference. In fact, this is something that you should be aware, when we, I think in the month of March, when there was an assembly session, this was, we gave data that we have said only 4 ventilators were there dedicated for COVID. But today, around 70, we have freed up. And I'm talking about invasive ventilators. Non-invasive ventilators, we have about another 80 BiPAPs. So we have, what we have done, it's a very interesting thing again, Meghalaya, how we did differently. In fact, this has become a best practice, in fact, both behavior change management as well as the medical expert committee that we constituted. So we have constituted a medical expert committee right from the beginning, and we started taking ideas from them. So they go, they see what's happening in different countries and different states, which is working, what is not working. So we prepare well in advance. In fact, we started preparing well in advance. In fact, hydroxychloroquine we procured long time ago. We have sufficient stocks. So azithromycin, hydroxychloroquine. In fact, now today ICMR is suggesting that mild cases can be treated with hydroxychloroquine. So different. So we similarly BiPAP missions. One of the expert committee members suggested that we can have these missions. So we build that infrastructure. Today, what we did, we have a system in case of a surge. In case of a surge, surge means this, how the surge happens. That's also a very important point. I would like to share it here, because surge means this particular disease. I think we have shown this one right from the beginning to everyone, but this I just wanted to show. So it's a basic reproduction rate. Okay, what I say. I think so. Basic reproduction rate, one person can actually transmit. Okay, so this is the transmissibility, and this person actually again 3, this person again 3, this person again 3. That's what I said. In a month, this one person can actually go up to 400. Our idea is that suppose if everyone knows how to protect themselves, this will not actually go to 1 to, it will maybe one person will go to only 1. Then actually it is easily, you can handle it. It's easy to handle it. But if this way it goes, this is a challenge. But what we have done as a state, we started actually looking at a worst case scenario. What if we also actually get infected like South Korea? So how many cases would come in next 3 months? So that kind of a modeling we had. I call it a mathematical modeling. Again, we have used Indian Institute of Public Health, and they engaged one professor from Indian Statistical Institute. So we created a one SEER model. It's called, basically how many susceptible, exposed, and recovered. Basically that's a SEER model, infected and recovered, SEER, SEIR. So the SEER model we used, based on that, we expect that, like, in case of a surge, for a Meghalaya, how many number of, cases that fall in different categories. So we have estimated. For example, maybe the asymptomatic will be more than 80%. So they may be, they can be about 10,000. But those people who require oxygen support would be around 1,200 or 1,300. So they require hospital beds. So we have those hospital beds. We have those, oxygen, systems also, to a large extent. In fact, we have oxygen systems. Similarly, those who require the critical care, who require ICU, as I said, again, that system also we are building. So today we have, to a large extent, we have that, the healthcare infrastructure. We could able to build over a period of time. Like, in fact, we got a good lead time, because see, we have less stress because we didn't have many cases. So we focused more on strengthening our systems. So it's a very important thing. This way I wanted to say one more concept, to the audience. One of the concepts. One is like prevention is much better than a cure. One. So that's where we are saying the behavior change management is so important. Why it is so important? Because there is one, I'll tell you, when you are actually in stress, you can't actually, function rationally, or you can't actually think properly. There is a again one case done by one Harvard professor with sugarcane farmers. When the sugarcane farmers in UP, they try to see the behavior of these sugarcane farmers, before harvest and after harvest. Before harvest, they have to take loans, they have to, they are indebted, they have to do a lot of work. So their stress levels are high, their IQ levels, when they measure, IQ level is low. After harvest, the IQ level is high. So what does it mean? Is that, like, you need to have, so you need to have a less stress to really work on different things, even livelihoods. So that's why prevention is so important. If you have, if you really take proper care, you will have less number of cases, you will have a less stress, then the economy can go on. People can, earn their livelihoods. It's so important. So health and livelihoods are very much interconnected, and that's why actually we need to really focus on the aspects, how actually we can prevent it, how actually we can build the capacity. So another thing is that we should not have the fear. Another thing, fear. When you have more number of cases, the fear will actually will lead you, rather than our the judgment, our the right kind of a decision that we should take at that point of time. So I think that's again another very important thing, from the management point of view, is removal of fear. If you don't have a fear, then you can actually really understand how to, handle it. So that's a very important thing. But we have good positive deviance cases, I would say, like a Pamlakrai headman, the way they did. So we have a great cases, in fact, and the way they shared their stories, their testimonies, and they are really inspiring. Yeah.
So when you talk about fear, we are reminded of the saying, fear of the unknown is the greatest fear of all.
Yeah, that's correct.
I mean, this virus,
is invisible.
It's invisible. We don't know how it looks like, how it behaves. And until we get a vaccine, we have to live with it.
Yeah.
So, sir, as chief of the COVID-19, do you foresee a surge in cases in Meghalaya?
See, honestly, if you do things right, again, I'd like to use what you said, the checklist. If everyone follows the checklist, do things right, we can handle the situation much effectively, much better than like the way we have been handling so far. That's a note. But as I said, that's where everyone's participation is important. Everyone, in fact, yesterday our Honorable Chief Minister has mentioned, even through the media, that here at this point of time, it's not only the healthcare workers, not only the government, it is every citizen, actually, everyone has to, become a COVID warrior. So that's the message I think we should take it forward to handle the situation. But as I said, if we do things right, yes, we'll be safe.
So there won't be much of a surge.
Yeah. But as I said, we should not be complacent. We should, everyone, that's what everyone. So I wanted to tell one more thing to there's two beautiful systems, in fact the health systems, they call it breach. Breach, when you are in a hospital with a COVID patient, if somebody is actually removed the mask, it's a breach. So I think when you are in a public place, you should understand this. You should not have the breach. Similarly, you should not have a breach of hand hygiene. You should always, you are traveling, before eating, before touching any other person, you should always wash your hands and do that sanitizer, and try to maintain physical distance. And one person is wearing mask, another person is not wearing mask, is not useful. Everyone has to wear mask. So one very important thing, another important thing that COVID is teaching us, it doesn't discriminate anybody.
True.
So everyone has to follow. Yes. It's such an egalitarian disease. So I think so that's something that we need to tell this message. And I think that's if only thing is currently there's no understanding. If there is understanding, everybody would follow. I believe that way. Though there is some, if you don't follow, you can impose fine and all. That will also help to some extent. But main thing is that I think people should understand this characteristics, how it operates. And if they know it, I think definitely everybody would follow. Why they wanted to, take a risk of, for themselves or, for their own dear ones. I think we need to bring that sensitivity and, understanding among everyone.
So what you said is very true. COVID is non-discriminatory. In fact, we can say after death, COVID is the next greatest leveler. So what we see is when the unlock happened, people have started, flouting a lot of protocols. We see them every day. They don't wear their mask properly. Some of them, they don't even wear at all. They go to crowded.
These two also to report these violations and make sure that everybody follows them. That is there.
So what kind of support have you received from the political leadership? Has it been positive so far? Has the political leadership stood
great.
The officers and
they're amazing. In fact, Meghalaya is actually setting a great example for the nation, if you ask me, because great leadership we have. In fact, we work like this. I'll tell you how our day goes. We'll have morning, we have 9:30, we have video conference with all the deputy commissioners, the DMHOs. We have like a 1 hour session complete, not only on COVID preparation. These days we are also talking about how non-COVID, especially saving mothers and children. So every week almost like 4 mothers are dying. Actually we need to save them, and every week around 50 children are dying. We need to really save. So these are the issues actually that we are handling it. And after that, we take that all the data. Then we have at 3 o'clock we have a cabinet, select members, that our honorable CM and honorable deputy CM and the few ministers, and senior, our respected chief secretary, and we all have a iteration, like what are the challenges, what kind of a policy is required. We decide about it. Then by evening we have a state response team meeting of the health department. Again we discuss about with all the issues, what protocols are required, what things have to be changed. So it's a very iterative approach. It's not like a kind of a one approach, you decide something and go down. We actually discuss, iterate what is good, and everyone gets a clarity. So that way we have state leadership is providing that clarity. And we also have a beautiful, in fact, our honorable speaker has convened a meeting with everyone, in fact, opposition members, and so everyone is actually supportive of this effort. So that way we are very lucky to have, similarly, as I said, the entire traditional institutions, the darbars and Nukmas, everyone is actually supportive of this. They're putting, in fact, they set up even the community quarantine centers. That's a great example for the nation. So we are having that way it's a very iterative approach. So very decentralized, leadership model, I would say. So state is actually giving that, state leadership is giving that autonomy to create the decentralized leadership to handle this situation.
You must be under a lot of stress because there are also many challenges.
Yeah.
So if you can explain what are those challenges and how you handling this enormous stress.
Yeah. No, one is that, in fact, honestly, one thing we need to follow, everyone also, that everyone has to, during these times, you should, one thing it taught me, in fact, today I'm actually walking every day, not less than 10 kilometers. So, so it's a stress buster. So you need to, I think this is something, it also helps us immunity, and all that. So I think we need to, it's a very purposeful journey. I think it's good. So far it's good, and everything is, I just said, we work with a concept of present, what's happening today.
And every day you learn new things.
Yeah, that's correct.
So one last thing, what is the way forward for Meghalaya?
So I just said, we have a very clear strategy for Meghalaya. That's something for, especially this actually interview is essentially for the COVID. So I would like to tell about that one. We started with the 3 strategies. I defined the 3 strategies with 3 keywords: data, systems, community. Data, systems, community. So we use the data to track the transmission chain. We strengthen the health systems so that we can actually meet any eventuality. Third one is building the community capacity and involving the community, in handling this entire effort. Now actually we are going for the 4th strategy of behavior change management, which is so important for living with the community. If you want to live with living with the COVID, behavior change management is so important for living with the COVID situation. So that actually we can have livelihoods, which are very important. Okay. And we also, as part of this, we also saying one very important thing way forward. If you ask me, apart from health, actually health side, yes, we need to build the health systems, keep on strengthening the health systems. And we are using this opportunity, COVID opportunity. In fact, the state government is very committed. In fact, in terms of building the entire infrastructure, whatever the support is required for the healthcare, it's a lot of focus and and is there. A lot of channelization of resources is happening. And what is what actually I'm seeing, one more aspect, I also look after the rural development. So I also looking after this one Chief Minister's Task Force Committee, one particular poverty alleviation and livelihoods aspect. So what we are anticipating, in fact, I'm using this word anticipating, is that there is a global slowdown. So that can actually slowly will come. It's not like a COVID. COVID actually has come very quickly. True. But this global slowdown, it's going to come. We need to prepare for it. How we can prepare for it? Use the same anticipatory strategy, like ant. Ant is like ant. I'm talking about ant. What ants do? They save for distress period. They save during the non-rainy season. They store all the food for the rainy day, so that they can actually. Now actually, what if you ask me, from the one, taking care of the behavior change, like for in terms of protecting ourselves from the COVID or isolating this COVID virus. Second important thing is that we need to change our behavior to actually to work like that ant with an anticipatory strategy to keep enough resources for future distress. How that can happen is that we need to go for a massive savings mobilization. If you have, like two things, like save one for tomorrow. If you have 100 rupees, save 50 rupees for tomorrow. It might be slightly, you cut down your expenditure, but it's so important. So that's where we are actually now promoting self-help groups. This is what one of the things is, that we wanted to bring every household under the self-help group network. So self-help groups provides an opportunity for savings, small savings, but those savings will come of a great help when there is a distress. So that's one very important, because when there is an economic slowdown, the main problem is your cash flow. You will not have money. So you need to actually save money for future. This is so important. And for that, we need to work on it. So if you actually work on both these strategies, like, for both the things, actually you require a behavior change again. So I think that's where we have in our last slide of our behavior change management training is this only. You can apply this one for poverty reduction, even for mitigation of future crisis.
Thank you so much, sir, for your time.
Yeah, thank you.
And viewers, just to remind you again, Mr. Kumar has reminded us about the importance of behavioral change. Not only to keep ourselves fit and free from the virus, but also to save our livelihoods. And yes, as I said in the beginning, maintain a checklist, a mental checklist, whether you're wearing a mask, maintaining physical distancing, whether you're practicing hand hygiene and other health etiquettes. And make sure you do it right. Because once you do it right, together we will achieve this war against COVID-19. Thank you very much.
Thank you very much.
Thank you, sir.
Thank you.